Hi, this is Dr. Sara Sabokpey at Confidential Studios. We get a lot of questions about smile makeovers, so I wanted to address some of those questions today. What is a smile makeover? A smile makeover is changing the appearance, health, and function of your teeth so that you can smile confidently, knowing that your smile is beautiful, it is healthy, and it is functional. There are a lot of different options in cosmetic dentistry for smile makeovers. There are options for implants, Invisalign, veneers, crowns, bonding. A lot of things can be used to restore the aesthetics, function, and health of your teeth so that your smile is harmonious and fits within your face. There are a lot of concerns that a full smile makeover can address. For example, if we have chipping in the teeth, if we have discoloration, if we have malocclusion, if there are missing teeth and spaces that we need to keep or get rid of, or there's function that we need to restore. For example, if there are teeth that are ground down a lot and we need to open the bite to give a more youthful smile with a better function, that's considered a smile makeover. Anybody with full adult dentition is a good candidate for smile makeover. It could be changing the way your teeth are coming together. It could be helping move your teeth so that you can function better, meaning that if you have imbalanced occlusion, we need to change it. We need to make sure your teeth fit within your mouth, within your smile. You are a great candidate for a smile makeover. Also, if you need to change the aesthetics of your smile, if you want a wider smile, if you want teeth that are better fitted with or suited within your smile and your full facial features, you're a great candidate for a smile makeover to make sure the way you smile actually fits the way you want to look. So for us to determine what kind of treatments are suitable for someone who's coming in for a smile makeover, we have to do a comprehensive assessment. We have to check if the patient's bite. We have to check for any cavities. We have to check for occlusion or how your teeth are coming together. We have to check for grinding patterns, your sleep patterns. A lot of things come into play to determine and diagnose what would work best for each and individual patient. We also like to hear from the patient what their goals are. We want to know how you want to look, what you want to change about your smile, and how you want it to fit within your whole aesthetics. So we ask the patients come in for a consultation or an assessment of their smile and their situation and their function to determine what works best for them. So during the smile makeover consultation, we take aesthetic photos, we scan the patient's bite and occlusion, and we also take x-rays if we don't already have them. We will sit down with the patient to go through all of their goals and what their ideal smile looks like. And we will determine and make sure that that ideal smile will also function well and is free of any cavities, decay, or any gum disease. So we do recommend that patients take care of their gum disease, any cavities, any underlying issues before we go through an aesthetic smile makeover. So we call it a holistic smile makeover for that reason, because we want to make sure that we address any underlying issues and any foundational issues before we make the smile very aesthetic. The way smile makeovers are different from a single tooth cosmetic restoration is that we have to look at the full function of the mouth and of the jaw and the gum areas everywhere instead of just focusing on one tooth. So although when we do one tooth makeover or one tooth cosmetic restoration, we do look at everything else. For a smile makeover, it's a more involved and comprehensive process in terms of making sure that all the teeth that are changing in shape, size, form, they are all fitting together and working in harmony. Veneers fit really well within a smile makeover plan, especially for patients who only need to change a small amount of chipping, a little bit of a color change, minor malocclusion or crowding, or any minor issues that can be resolved without removing too much of tooth structure. Veneers are a very thin shell that go over the teeth to address those issues. And for larger issues, we might have to use dental crowns, or if they're missing teeth, we have to do implants. If there's a lot of crowding, we usually go through um, Invisalign and straightening the teeth first before we do any kind of veneers. Especially for our patients who have a lot of clenching and grinding, we would have to do a lot of assessments to make sure that if we are putting veneers on, they're going to work and they're not going to chip and fall off. Smile makeover appointments typically take between 3 to 4 appointments, depending on the needs of the patient and what we're trying to achieve. If we are going straight for veneers or crowns, we have to do a consultation first. And then after that, we go through an appointment where we do the preparation for the patient. And then we mock up the new smile. We let the patient go around and live with that mock up to see what their idea is, if they like it, if they need to change anything about it. And then after that, we bring the patient in and finalize the mock-up and provide the final restoration at the last appointment. Now, if the patient needs to do implants, then if we have to bring the patient in for more appointments before we even start placing the final restorations, just to make sure that the implant is in place. One-day smile makeover appointments are really not possible because we want to make sure that we provide a smile makeover that lasts a long time, is aesthetic, functional, and also, as mentioned before, they are great for the health of the patient. So we need to make sure the consultation appointment is done and is not skipped. We need to make sure the preparation appointment is done and not skipped. We do make sure that we have a smile makeover mock-up before we start our preps, meaning that we do a digital or wax mock-up for the patient so that they can see their final smile before we even touch the teeth. And then we do the mock-up. We transfer the mock-up inside the mouth so that the patient can actually walk around with that mock-up. So a one-day smile makeover is not something that is possible or aesthetic or robust. Smile makeover results can last a long time. It all depends on the patient's home care, how much they follow up with their dental care and dental visits, make sure they are caring for their crowns, veneers, implants. If we're going through Invisalign, for example, how much are they following up and are they compliant with wearing their retainers and with wearing their aligners? So it all depends on the relationship we can build with the patient and how much the patient can actually follow through with those and allow us to help with the part that we play in the longevity of your smile makeover. As a patient, when you are looking to choose a provider or comparing prices for a smile makeover procedure, my suggestion is look at the processes that each provider is using and employing, and also how much they actually care and sit down and talk to you, and if they appreciate your goals. What is important is the material used, the process employed, and the proficiency of the provider. So my suggestion is don't go for the cheapest option, go for the option that fits your goals and your dreams. I hope I've been able to answer most of your questions. If you have any other questions or would like to call us to schedule a consultation for your smile makeover, please call us at 310-499-2048.